We've all been hearing advertisements on the TV and radio about the recent advances in modern dentistry. What are some of these new products and services, and what do they really entail? Join us on The Better Part as we take a trip into the world of modern dentistry and discuss some of the new services available to consumers.
Welcome to The Better Part, a program that encompasses a diverse spectrum of topics important to our community, which we hope will both inform and entertain you. We invite you to sit back and enjoy the program.
Hello, my name is Charles Bedord, and my guest today is a Cupertino dentist, Dr. Preethi Rajakapol, Doctor of Dentistry. Dr. Rajakapol, thank you very much for taking time out from your busy practice to discuss these topics. And may I call you Dr. Raj?
Absolutely.
Okay, thank you.
Thank you for having me on the show. This is such a great opportunity to reach out to people, to all your audiences, and express my opinions. Thank you so much.
Well, we really appreciate you being able to take the time to come here. And could you tell me a little bit about your background, please? How you came to Cupertino, how you got into dentistry, and other interesting parts of your life.
I belong to a family of engineers, and I turned out to be the black sheep of the family. Decided to become a doctor. As far long as back as I can remember, I've always wanted to be a doctor. I did my Bachelor of Dental Surgery in Nagpur, that's a place in India. And then I got married in 1999 and moved to the US here. And I did my further education here.
I see.
I went to UCLA for my training for the boards, and then I finished my boards.
Well, one of the things we'd like to do on this show is to just talk about some of the things that we hear about in the commercial media. And one of the topics I'd like to start with, Invisalign. I hear about this all the time in the media. And could you tell us a little bit, what is it? And well, let's just start with that. What is Invisalign?
Invisalign is a clear way to straighten your teeth, especially for people who are conscious about not wearing the regular old metallic braces and
I see.
Being sparky. So it's a beautiful way to straighten your teeth. It's clear nobody knows that you're straightening your teeth, and it can be done at any age. Even older people can do it, not a problem at all. You change your aligners every couple of weeks. You have to wear your aligners like 22 hours a day at least.
I see. So you do sleep with them, though.
You do sleep with them,
I
yes.
see.
Yes. The only thing you're allowed to take them out for is for eating, drinking, and brushing and flossing. Of the day, like 22 hours at least you wear it. You change it every 15 days. You change the aligners, and the most beautiful part of Invisalign is actually you can see the end result right in the very beginning on a computer screen.
Oh, really?
Yeah, that is just beautiful.
So they go into your office and you can let them look at it on a computer screen? Or?
Yes, yes.
That's
So if you start in the month of April, you can see where you would be in the month of September, where you would be in the month of December. That is the beauty of it. And at any given point, if you want to change anything, if you want to modify something, can be done very easily.
Oh, and congratulations to the engineers too. That's wonderful software. So is this something you just just place on over the top of your teeth and they just wait?
Yes, I actually have a model
okay.
right here. So these are the two aligners. So you just place them on your teeth. As you can see, they're removable.
Right.
You can take it out for eating. You place them on the teeth, and slowly and in a controlled way, they apply pressure in various areas so that your teeth come into the place where you want it to be.
Now, are these a complete replacement for braces? I mean, for instance, my son went through the braces stage, and when he went through the braces stage, all the kids had braces. I mean, is this something that can be used in young children too to help align the teeth, or are there some patients who this is not appropriate for?
There are some cases that this is not appropriate for. Invisalign cannot correct a few things that traditional braces can. Invisalign is more cosmetic, but they are evolving a lot from where they were. They are evolving a lot, and more cases are being able to be corrected with just the Invisalign. But sometimes there is no substitute for traditional braces. Sometimes, in some severe cases, traditional braces is the way to go. So,
But this is something that young children too could look at, an option for them perhaps.
yes, not,
An option.
I wouldn't recommend them for very young children. In very young children, you want to correct their crowding or malalignment in a proper way so that their bite and everything is fixed there. The jaw, the growth, everything is in harmony, and it's fixed in the right way. Invisalign can only fix the malalignment of the teeth. If there is any jaw expansion or something that's
Right.
needed, Invisalign cannot fix that.
Well, where is Invisalign available? Can you go to any dentist's office and get this, or?
Pretty much all dentists offer Invisalign now. The dentist has to be Invisalign certified.
Right.
All orthodontists obviously can do it. Whoever gets certification of Invisalign, they can definitely do it.
Another topic that we hear a lot about on television especially, tooth whitening. And this is something that's kind of grabbed my attention. And you hear about different tooth whitening products. Some of these are available over the counter. Some are very specialized, and I guess you need professional attention for this. What are these various tooth whitening procedures? When we see the athlete on TV showing off their bright
Pearly
white teeth
whites.
and so on, what's available out there in the market, and what are some of the pros and cons of these various types?
There are, like you said, various types of whitening systems available. The simplest one would be the one that is over the counter, the Crest whitening strips, or there are multiple brands of whitening strips that you can get.
Okay.
And those are pretty good results. The next best thing would be a take-home whitening kit that your dentist can give you. What we do is take impressions and give you a tray pretty similar to the Invisalign tray.
Okay.
It's a little bit thinner than this one. We give you a gel that's placed inside these trays, and you wear it at home, just
see.
like the over-the-counter strips. But these are of a higher concentration because the dentist dispensed it. Excellent results again. But the state-of-the-art whitening, that would be the Zoom whitening.
Oh, the Zoom whitening?
Yeah.
Oh, I got to hear about this.
This is done in office.
Okay.
Your dentist is going to put you on a high fluoride toothpaste for a week or two before
Okay.
this procedure. This procedure itself is like a couple of hours in your dentist's office.
Oh, so that's a real time commitment, yeah.
It is.
Yeah.
That is one of the, yeah. But the good part is you're done in one sitting. You're usually done.
Right.
A liquid rubber dam is placed on your gums to protect your gums, and high intensity light is used to activate the gel that's put on your teeth for whitening.
Oh, okay. Do you need to go back for repeated procedures on these?
With the Zoom whitening, we rarely see anybody come back
Right.
for. Usually, people are satisfied with because it's very good. It's an intense, bright blue light, and you get your results right away. With the take-home trays, people repeat it once in a while.
I see.
Yeah.
Another topic I want to ask you about, we hear things about painless dentistry. I hear this on the radio so often. Now, what is the definition of painless dentistry, and how does it differ from, I'll call it regular dentistry, or what's regularly used in the office now? Talk a little bit about this.
Sure. Pain and dentistry, fear of dentistry, fear, pain, dentistry. I think all three words go together.
That's right. That's right.
So painless dentistry would mean that the patient is so comfortable that they don't care what's happening, right? There are various means to do that. One would be nitrous oxide sedation. Another one would be conscious sedation. These are the various types of sedation where you are you are conscious, but you're so out of it you don't care what your dentist is doing.
Now, are these done by IV administration, or are these pills that you take, or?
No, nitrous oxide is a gas
Okay.
that we administer with nitrous oxide and an oxygen
Right,
combination.
right.
It's administered nasally. The conscious sedation, though, yes, is you have to run an IV line for that.
Okay.
You have to have various agents are used, like Demerol and stuff.
I
Various
take it
agents
that
are
this is
used.
not used for your run-of-the-mill cavity or something like this. This is, or
Actually,
is it?
Actually, some people are very, very fearful. So
Okay.
nitrous oxide is used very commonly. I would say I use nitrous oxide at least once or twice a week on my patients.
Okay.
Some people who are very fearful,
Mm-hmm.
so I use nitrous oxide.
Mm-hmm.
Now, the conscious sedation, that's not your run-of-the-mill. That's something a specialist would do, something like, let's say, your oral surgeon or for a child, a pedodontist would do.
Right.
So that is one kind. The other way of painless dentistry, you might have heard of laser dentistry.
What is that again?
This is a laser dentistry we use water.
Oh, I've heard about that. Yeah, yeah, that's been advertised recently.
Yes, yes.
Yes.
So water and lasers are used together to cut into the tooth. When we say fill a cavity, what we mean is with the traditional drills, you remove the decayed tooth structure
Right.
and then fill the cavity with a white filling. With this biolace technology, we can do that with lasers and water without actually the friction and the pain of the actual drilling.
Now, is this going to expand? I mean, this sounds like it's great. I mean, do you see this growing in youth?
Yes, yes, most definitely. I'm sure there's going to be a time when traditional drills are going to go out completely, and this is
Right.
going to be. Traditional drills might still have their place in complicated cases and things like that, but this is a beautiful technology that's coming in, and I'm sure it's going to catch on.
Can you tell us what is a snap-on smile?
A snap-on smile is your ticket to Hollywood.
Oh, it is. Okay, okay. You
It's-
got 10,000 new customers coming right now.
It's your instant smile. Like, let's say you have molar-lined teeth, you have chipped, broken teeth, you have discolored teeth.
Right.
But let's say they're all healthy, healthy meaning decay-free. And you want to do something very quick to fix it, so that, let's say you have a wedding to get to next week.
Right.
And you have to fix it really quick. So I have a model.
Oh, you brought a smile. Okay.
This is a snap-on smile. So it goes right on top of your teeth. You put it on like this, right on top, and you fix it like this.
So it slides over your
Slides
teeth.
over your teeth, and you have the perfect smile.
Artificial tooth whitening or something with all the teeth in alignment and.
No, it's nothing. There's no whitening or anything
Yeah,
involved.
yeah.
But yes, it is an artificial way to get like a beautiful smile instantly. So, but I have to say that this is in no way a replacement for healthy teeth. Like, let's say you need lots of fillings and you need root canals and things like that.
Right.
This is not in replacement of that. You still need to fill those teeth. You need to make it cavity free. You need to make it disease free before you can get this on.
Mm-hmm.
This is not to be considered that, oh, you know, I have 5 cavities, let me just get this. That's not what it is. It's completely aesthetic. Your teeth
Right.
have to be healthy before you get this on, because the problems that are going on inside, they will continue to grow bigger otherwise.
And I've heard that there's some substantial advances in the area of crowns and bridges and what these can do for patients. Can you talk about these in general?
Sure. Crowns and bridges, the traditional crowns and bridges had gold in them, covered with porcelain on top.
Right.
I have a picture. So this is the porcelain fused to the gold or metal kind of crowns. We now have crowns that are free of any kind of metal.
Oh, really? Okay.
So these crowns are called lava crowns. They are very, very strong. They have no gold or no metal in them at all. So you can imagine they're very aesthetic.
Well, what did the crowns used to be composed of then?
Porcelain and gold.
Okay.
Yeah. So these crowns are, these lava crowns are great. They're very, very strong. They're very aesthetic, and they last you for a really long time.
What is a bridge?
A bridge would be like you have a missing tooth right here,
Right.
and you want to replace it. So a bridge is one of the options that you have to replace this. We would put a tooth here and attach it to a tooth in between,
Okay.
and then make it a 3-unit, very similar to a bridge, to a real bridge.
Okay.
We would make it a 3-unit bridge and cement it on right here, so that we have this tooth available now. We have the tooth in between now. So
I see.
that is one of the options for missing teeth.
Okay, because a lot of missing teeth is kind of a common problem, isn't it?
Yes, yes.
So, can you talk a little bit about recent advancements in dental care for the elderly?
Yes, dental care for
And,
the
yeah, I know I've got a mother-in-law, and you know, I look back at what my own parents went through with their dental care and so on, and it was relatively painful, time-consuming, and very, very expensive. And I was wondering, what's new in this area?
The newest thing in the area of geriatric dentistry is a subject pretty close to my heart.
Okay, great.
The newest thing would be, I wouldn't call it brand new, but the newest thing would be metal-free dentures.
Really?
Now, as you know, most older people have lost a lot of their teeth, right? So, if you have to put a denture in your mouth that's full of metal,
Oh,
like
wow,
this.
that really is. I'd never seen one of those, actually, to be honest with you. That's,
This is the traditional denture, partial denture, where
Okay.
you had all this metal that goes into your mouth. Looks fairly uncomfortable,
yes,
right?
it does.
And with all these sharp prongs. With older people, they are losing, as they grow older and older, they're losing their dexterity,
Right.
And they're losing their control over their fingers and everything. So to put this in and out each time and to live with this metallic taste in the mouth is, I'm
Yeah.
sure, no fun at all.
Right.
There is this thing called a Valplast denture. Now this one, as you can see, is completely metal free.
Okay.
It's
What's it composed of?
this is composed of a material called Valplast. This is not your traditional acrylic. This is
Okay.
Valplast. Now this is so light. It's if you can feel it out, it's so
Yeah.
light. It's just a model.
It's almost not there.
It's not there. How would you feel wearing this versus wearing this?
Let me feel this one. Oh, yeah. Yeah, this looks kind of grotesque.
Scary. Right. So this is the metal-free one. This is made of Valplast, and my patients love it. It works beautifully, and they're very comfortable with it.
Good.
I think the biggest thing is the lack of the metallic taste.
Right.
You know, wearing this much
What's
of
the metal there that's made out of?
This metal is nickel.
Oh, okay. So
Yeah,
that will have
it's not. Yes, it's not
Yeah.
a noble metal. It's
Right.
not gold or anything. So it will have a taste, and a nickel and a combination of other metals. So this is absolutely beautiful.
What are the options for people confined to nursing homes as far as getting this type of dental care? Is it really readily available, or is it difficult to get?
It is not difficult to get. There are more and more companies coming up with more home services.
Right.
They go home. They go to the patient's home or to the nursing facility, and they work on the patient there. In some instances where patients have a very complicated medical history,
Right.
they're going to bring them to the hospital.
Right.
So that's called hospital dentistry. But otherwise, there are companies out there that will go to your home and work on patients.
So
right
you
there.
can do a filling or do a crown in a nursing home.
Yes, absolutely.
Okay, well that's good to know, because I think a lot of people just kind of feel, oh, this is going to be such a hassle, it's going to be so expensive, and they just want to ignore it then.
Oh, no, no, no. That is a very easy thing to do these days, I think. Also, I want to digress a little bit and talk about nursing home care or care for the elderly with respect to oral hygiene.
Okay.
Oral hygiene in the elderly is very, very important, more so because most elderly patients are taking some kind of drugs, right, for either
Right.
high blood pressure or diabetes or whatever. So a side effects of lot of these drugs is actually something called dry mouth. Dry mouth is a very real thing, and what dry mouth means is decreased salivary production, because your glands are being stopped from producing
Right.
the saliva because of these drugs. Now, these drugs you cannot stop them because they are important. They are keeping you alive. Very important that we substitute artificial saliva. We
Okay.
we do some and we do extra diligent home care, right, to prevent cavities and prevent gum disease. So most of my patients, most of my elderly patients, I have them on a 3-month recall, cleaning 3-month recall, as opposed to, you know, your regular 6 months. You go to the dentist every 6 months. But for the elderly, you want to do it every 3 months.
Okay.
You want to do their
Every 3
cleanings every
months.
3 months, and you want to do this artificial saliva to keep, you know, cavities from going to town there. Also, I highly recommend the electric toothbrushes.
Okay, I have one. I use it twice a day.
Good, good.
My wife does too.
So you're good. Yeah, electric toothbrushes are a beautiful way to control plaque.
Okay.
They take off plaque very well. And flossing, of course. They've come up with new flossers that's helpful for people with
Right.
arthritis and people who cannot use their fingers very well again. These are electronic flossers.
One thing I got to get your opinion on, I'm interested in this, is that this is a real hot public debate in many cities. Fluorinated water. Now, as a dentist and as a scientist too, because you've had a lot of scientific training, what is your opinion, on fluorination of public water supplies?
I am pro. I want water fluoridation there. Very, very interesting fact that I have been observing this myself in my practice here and in my practice in India, both places. When I compare it, I see that in India, the Indian Americans living here, I see that their decay rate is lower compared to people who are born and brought up in non-fluoridated areas.
So the water in India
Is fluoridated.
Is fluoridated. I didn't know. That's interesting.
The water in most places in India is fluoridated. So it's interesting. This is a a small research that I've been holding on my own,
Right.
just a demographic study. I see that the decay rate is actually lower in the Indian Americans here than, like I said, the people who haven't had fluoride exposure. Now, exposure to fluoride does not mean your toothpaste or your mouthwash. That's not your
Right.
your exposure to fluoride. What it is some kind of ingestible fluoride. So that's either going to be fluoridated water or fluoridated pills for children.
Okay.
So now this is something you want to do when the adult teeth are developing inside the mouth. So that is between the age of, let's say, 3 to 10. Now the adult teeth start developing even when the child is in utero.
Right.
But at the time where you're comfortable giving the fluoridated drops, you can start. I had my children on fluoridated drops at the age of 6 months. So the rate of decay is much lesser because this fluoride is actually incorporated into the forming tooth. And when the tooth is forming, like a building block, it's incorporated into the tooth.
Okay.
Now,
So it's very important to get this
yes,
in early.
yes, it is. because after the age of 12 you don't really need to drink or you don't need any kind of ingestible fluoride. Your teeth are developed already.
One final question I do want to touch on, and we're kind of running short on time here, but I do want to hear a little bit about this, is that recently there's been articles in the paper, for instance, about a link between gum disease and cardiovascular disease.
Yes.
What's new in this area, and do you have any comments on this link?
Yes. Gum disease is linked to cardiovascular disease and stroke even. There have been various studies, various research going on in this field. The reason being that the bacteria that causes gum disease, they go back to your heart and they colonize there and they can cause heart disease. But very interesting, you should tell me this, because just yesterday the ADA came up, this is just yesterday, the ADA came up with a study that they published that there might not be a very big link between the two.
I see.
So it is still, I think, under research whether or not they are linked. A set of people are saying yes, they're linked, and a set of people are saying no, they're not linked. But if you look at it demographic wise, I see that people with gum disease, with advanced gum disease, they do have heart disease. I cannot say with conviction that this caused this. But
right, it's not a definite
Yes.
cause effect. It might
Yeah.
be related to age because
it might be related
yeah,
to
but
anything.
but it's a possibility.
It's a possibility.
Interesting to look into.
It's a
yes.
possibility,
Yeah.
and gum disease by itself is an actual disease.
Well, Dr. Rajagopal or Dr. Raj, whichever you prefer, this has been a very interesting conversation. I thoroughly enjoyed talking with you, and I appreciate your time, and thank you for joining us on The Better Part. I know you have an extremely busy practice in dentistry, and I'd also like to invite the audience to tune in, same time next week, for another edition of The Better Part. Thank you.
Thank you so much.